Hello, welcome. My name is Angela Spence Bedard. I'm your Communication Director for the Nurse Practitioner Association of Canada. Welcome to the 11th Annual International Council of Nursing, Nurse Practitioners, and Advanced Practice Nurses Network Conference. Our conference theme, Envisioning Advanced Practice Nursing Beyond 2020, Wider Reach, Bigger Impact. So that's our theme. I would like to talk to you in this small time that I have for the virtual booth here about my northern nursing experience. I've been a northern nurse, I guess, for almost 3 decades now, among First Nation, Inuit, and Métis communities across Canada. I myself, I am Indigenous. I speak Cree fluently, and my background is, of course, I have mixed heritage. Anyhow, I have lived experience of having lived on a reserve for the better part of the first 8 years of my life, I guess. I come from a family that has a history of residential school. My grandfather was impacted the first time, and then of course my late mother, and then myself being the third generation. So a lot of stuff has been happening nationally recently, and it had to do with the national dialogue on addressing anti-Indigenous racism in Canada's healthcare system. I had been part of this dialogue that was occurring earlier on in the year, and the focus of the conference, of course, was the dialogue had 4 components to it, I guess. One of them was cultural safety and humility training, and increasing Indigenous representation in post-secondary health education, traditional approaches to health, and safe patient navigation. These were some of the recommendations that we were talking about during this national conference, and I bring it to your attention because it's one of the things that are very important when you're a northern nurse, to be familiar with the cultural safety aspects of working in your community of interest as a community health nurse. So over the years in northern nursing, we've had a lot of challenges, of course. When I first came on, as a northern nurse, I guess it was back in 1994, there was already a shortage of nursing across Canada, and I was recruited, with First Nation Inuit Health Branch Medical Services at the time, and so I was in the nursing stations, and I had preceptors there that were seasoned nurses at the time, and I guess I was the next generation at that time. So since then, it's been almost like 3 decades. I've learned a lot in northern nursing. It's not an easy profession to be in. I started when I was very young. I guess I was 17 when I first started nursing school, but life challenges along the way taught me a lot of lessons too, and how to cope in northern nursing. Now, northern nursing is an organism of itself. You can work in an urban center as a nurse practitioner, and there's strict policies and directives that you follow. And well, it's the same thing with northern nursing. The communities that I've serviced range from Indigenous Services Canada nursing stations that are still run by Indigenous Services Canada. Most of these are Manitoba, and most of the other provinces, but primarily I'm in Saskatchewan these past few years, I guess. And in Saskatchewan, we have health authorities over there. There's different ones. Like right now, I work for Meadow Lake Tribal Council, and we are actually recruiting nurses. So if you're interested in becoming a Northern nurse, please contact me and I will have you recruited and trained, because one of the things that I do as a Northern nurse over the last few years is I've trained many nurses coming onto the field of Northern nursing, and we train you. We use clinical guidelines that we have adopted from Indigenous Services Canada, First Nation clinical guidelines. There's adult and pediatric guidelines that we use. In Saskatchewan, we use our other protocols, other clinical guidelines specifically from Saskatchewan Nursing Association. And these guidelines are used by expanded scope nurses, or AAPs. In Manitoba, they're called expanded scope nurses, and in other provinces as well. So um, coming on as an NP, working in Saskatchewan, have given me a lot of satisfaction, I guess you could say, from my career perspective, because I'm fulfilling a lot of things that I would love to do for the communities, and in terms of self-determinacy and advocacy, and helping stop um, racism in the healthcare for Indigenous people, uh, which I have done, over the years. I've done a lot of advocacy as part of being a nurse practitioner, and being an Indigenous nurse also. I've been involved in a lot of national and provincial organizations where I advocate in many different aspects of our lives. One of that part is the most recent one, of course, the anti-Indigenous racism in healthcare. And so we are so severely um, short for nursing supply in Canada. And one of my reasons for making this video is in hopes of recruiting other nurse practitioners out there that are working in urban centers, and in other areas of nursing, that want to try something different like Northern nursing. So I I would like to say that Northern nursing is not an easy job to do. A lot of nurses come here, and you either make it or you break it. For example, one of the nurses that, one of the many nurses that come nowadays are newer nurses that have just graduated, because we have a short supply. So we're trying to recruit as many nurses as possible, but at the same time, we are having to orientate these new nurses, which even makes it harder for myself. For example, I work with Meadow Lake Tribal Council. I'm actually the nurse in charge there, and slash nurse practitioner. I have two other nurses that I work with. This is actually a 4-nurse station. We do home care. We do all the programs, community health programs, such as immunization program, communicable disease program, uh, school health program, prenatal, postnatal, home visiting, home care, palliative care. There's a wide variety of services that we provide, besides doing community education as well. And these are the things that we orientate new nurses when they come on. We go through all these programs, and at the same time, we're trying to see patients, which I have to actually dovetail around quite a bit. Where I'm answering phone calls. Also, because the pharmacy might be phoning, or the hospital might be phoning, and a lot of the times in these clinics, the staffing is usually good, but sometimes the staff is not there, so you are left alone to have to fend for yourself to manage the clinic. Usually when there's no staff, well, of course we will close the clinic, but oftentimes, when there's no staff, I will be answering phone calls too, and seeing patients at the same time, and orientating nurses, and sometimes even when somebody comes through Emerge, uh, if there's a big mess in Emerge, well, I'll have to clean it up. I'll have to put on my other hat, which is the housekeeping, because the housekeeper is not available 24 hours a day sometimes, so you have to put on your other hat, start mopping the floor for your next patient. You want to always keep the room clean. And, the backup nurses that you have a first on-call nurse, and then you'll have the second on-call nurse. And the compensation that we get is very good, I can tell you that. So please apply. We do need some nurses in Meadow Lake Tribal Council. We just actually had our on-call rates actually went up a few days ago, so it's actually comparable to, I could say they're actually even better than the other ones across the provinces, because I actually worked, in Ontario, on Manitoulin Island. I've worked in Nunavut. I've worked in almost every nursing station in Manitoba over the past, almost 3 decades, I guess. So I've done a lot of work in my time. I've done a lot of advocacy. I'm getting older, and we need to recruit more nurses that are eager, that are, advocates for self-determinacy, for nurse practitioner association, and also for the Indigenous nation on Turtle Island here, because we've been here for a long time. My great grandfather and my great grandmother were, they were here, and we have to preserve our language, we have to preserve our culture, and we have to learn new ways of providing health in the healthcare, when we have to take into consideration culture safe care, providing culturally safe care. So that's where I come in too, and that's why I continue to do this profession in Northern Nursing, because people like me are needed, among my other seasoned Northern nurses that are out there. There's many of us. I can name quite a few of them now. I know they're all out there. Nurse practitioners are out there. Denise Redhead, in Manitoba, she's a colleague. And also, who else is there that's out there? And there's so many nurse practitioners, that are Indigenous and non-Indigenous. And we're all out there in the communities. Denise, for example, is working in Manitoba, where she's in Barons River. Barons River is First Nation took over their health, and they hire their own nurse practitioners, and she's over there. So there's other, most of the work that nurse practitioners are working in the cities, and you don't see very many in the nursing stations in Manitoba. But in Saskatchewan, there's quite a few all over the place, and especially in the nursing stations. And most of us are working part-time, or there's a couple of them that are full-time. And because we're slowing down in our careers, that's why we want to bring in new nurses with new knowledge and new perspectives and new ideas. And that's what this conference is about. We want to reach a wider reach, and make a bigger impact in our nursing. So that's what this 11th International Conference, Nurse Practitioners and Advanced Practice Nursing, the network conference, is all about. And I really hope you enjoy the conference. I have a lot of work ahead of me here in Saskatchewan with the nursing shortage and the recruitment and retention of nursing. And I really hope that some of you do consider Northern nursing in First Nations communities, because it'll help you uh, enrich your career, and you're working autonomously a lot of the times, and you have to have the skills, the emergency skills that a nurse requires, ACLS, PALS, ITLS. You need your immunization certification. You need your transportation of dangerous goods. You need your WIMIS. All these other little certifications that you require to become a Northern nurse. But once you're able to do all of those prerequisites, and then you'll be able to get your orientation, by an agency. If you come to MLTC, it'll probably be me. I might be orientating you if you come to Canoe, because we have our facility here that we use as an orientation for incoming nurses across MLTC nursing casual pool and incoming nurses. So thank you so much once again. My name is Angela. I hope to hear from you, and I will be looking at the virtual booth. And if you have any questions, you can always call me too. My number is 204-301-0826. Call me anytime, because if you're interested in Northern nursing, and you're ready to take a different challenge in your life, just give me a call, and we will do some recruiting for you, and get you in Northern nursing. Thank you so much, everyone, and have a good time at this conference. Thank you.